I decided very early on I wanted to be a physician and an orthopedist because I had a family member who was an orthopedist, and he was a pretty profound influence on me. And even before I knew what orthopedics I think really was, I was so impressed by him that I kind of followed in his footsteps, and fortunately it has turned out to be the right choice. I think it's sometimes you just fall into what you were meant to do. Sometimes people's misconception is that a surgeon's job is only to operate, and I think that the reality of it is our job as surgeons is to treat the patient's problem in the most appropriate way, which may not always be a surgical solution. Although that's why many of us do this, and that's what we enjoy doing. I think it's important for us as surgeons to identify what patients are candidates for surgery and what patients will improve with surgical interventions, and separate those out from people who may respond very well to conservative treatments, medical therapies, physical therapies. I mean, cliche, but I mean, I think when you're able to take a patient that comes in with a problem that that you're able to identify, you're able to come up with a treatment plan for, be it surgical or non-surgical, execute it, and they get better, and they get back to their life, and they get back to the quality of life, and are able to achieve whatever goals they have on a day-to-day basis, whether it's walking without pain all the way up to high-end sports and competitive athletics. I'm not sure there's a more rewarding portion of the job for me than that. We have complete authority over decisions that are made. It's exclusively an orthopedic outpatient surgery center, which means that we don't have other specialties, ear, nose, and throat, urology coming in. Our staff at every level do nothing but orthopedics on a daily basis, so they're familiar with each of our surgeons' preferences, and it becomes almost second nature, which I think lends itself to better outcomes at every level.